Yeah, so good afternoon, everyone. I have no conflicts of interest, no financial interest. Today I'll be speaking about Smartscope Kit, which is a portable eye hospital for screening in outreach programs. I'm Dr. HIRIKA GOSALIA, a postgraduate resident at Arvind Eye Hospital. It's a tertiary eye care center catering to a large population with a high quality treatment at affordable rates. Usually conventional instruments are quite difficult to be used because of bulkiness and risk to damage at outreach programs. And hence, when we go to camps, we use torchlight examination for anterior segment, and we use direct ophthalmoscope for the posterior segment. That's when I thought that maybe we are missing out on a lot of findings otherwise when we are just screening with these instruments. And we came up with the Smartscope kit, which is a comprehensive eye kit for every ophthalmologist, especially in outreach camps. So we measured the visual acuity with the Eye Handbook, which is a free download app, wherein we can measure the vision test, the Amslers, the color vision test. Then we also added the pinhole occluder, the plus 10 diopter lenses, the trial frame, and the trial set. In investigations of the systemic illness, we included the pulse oximeter, the BP machine, the glucometer, and many investigations for the orbit and the corneal pathologies. In the anterior segment, mainly, we included many innovative, easy tools like the iVerter, which was used for the eversions of the lid to remove the corneal foreign body, which is a good alternative to the universal eye speculum. We used the ASPI, which is the anterior segment photography intraocular lens, wherein we attached an intraocular lens which was a great alternative to the slit lamp examination. So we attached it behind the smartphone against the smartphone camera to capture good resolution, highly magnified images, and we used a flashlight for illumination, and we could detect many great findings for referral, especially like you can see in the next slide, wherein you can see all the pathologies captured from corneal to cataract to iris coloboma, PXF, ASCC to neovascular glaucoma to hydrops to OSSN to even pterygium, subluxated lens, and an eye syndrome. We measure the IOP with the shear stonometry. In cases of torchlight examination showing a doubtful narrow angle, we did a gonio ASPI, which is just adding a 8 diopter lens instead of the 15 diopter lens. And then in cases of ulcer suspect, we use the IOL which is an alternative to the compound microscope. We use 430 diopter lenses heaped upon each other, and then against the lens smartphone camera we could detect one case with fungal hyphae and another case with a foreign body sensation showing a sheep botfly larvae. So, and the next was the Scooby, which was a smartphone co-aided cobalt blue photography, wherein with the intraocular lens, we also added a cobalt blue filter. So, this was mainly for the corneal pathologies, wherein we saw many epithelial defect, we saw PEs, we even saw filamentary keratitis, dendritic ulcer. So, these comprised all the instruments for the anterior segment examination of the patient. Next, coming to the posterior segment examination, we did the trash to treasure at camp, the T3R, wherein we used a sanitizer bottle and we cut out one end of the bottle, and here we attached a 20 diopter lens for the examination of the fundus. The other lens, other side was attached with a adapter, wherein we attached a smartphone and to capture videos or images of the retina. So here are a few findings that we found: the retinal detachment, macular hole, and many diabetic retinopathy patients. So this was a Smartscope kit. So mainly we did this across. We normally go for camps in the Tamil Nadu, Kerala, and Karnataka, and we did it for 4,741 patients in 26 camps, wherein we found cataract in 83% and non-cataract in other cases. And then cataract we found immature cases the most, glaucoma we found PACS the most, and then retina we found diabetic retinopathy the most, orbit we found chalazion, and neuroophthalmology we found optic neuropathy. So out of those 4,741 patients, we referred cases for cataract as 1,220 and other non-cataract 254 cases, out of which treated were 937 for cataract and non-cataract around 99 cases. So Smartscope kit was a great alternative to the existing gold standard instruments, especially ASPE being for slit lamp, Scooby being for this blue filter, ILScope being for the compound microscope, and Trasher RedCam for the fundus camera, and also the eye handbook for the Snellen's chart. We also use the iVerter and Gonio ASPE for one for the lid version. So it is an effective screening method of patients in outreach camps from anterior to the posterior pathologies, can avoid misdiagnosis and missed diagnosis. It's a do-it-yourself, comprehensive, cost-effective, innovative kit which comprises all essential instruments, and it helps in spot diagnosis, earlier treatment, and helps in better prognosis of the pathology, helps to explain the importance of treatment and referral to the base hospital. I would like to conclude by saying this is a new age, innovative, effective screening tool, especially in places like outreach camps wherein you are devoid of many important investigations. Thank you.
Very nice.
Okay. You asked, you saw the fungus in the using the optics of the lens. Can you, could you see that bacteria or?
No, like of bacteria, we could only, mainly for fungal spores, it is quite helpful.
Yeah.
Bacteria, it was difficult, but for fungal
Yeah,
spores, it
sure.
was very helpful for us.
It is a very nice innovation.
Thank you,
Against
sir.
what background you saw this fungus?
Yes.
Against what background?
We did only the KOH mount, so we had the slides along with us in the kit.
Can this be used in a hospital setting also?
It can be used. I'm just showing. We are actually doing a. We have used it for many other studies. I'm just showing the use of it in the outreach camp.
You want to show that it is non-inferior to this slit lamp that we use
It's
in
a
the
good
hospital.
alternative, is what I would like to say.
Thank you.
Thank you, sir.